Good morning, and thank you for joining us for our September 10th, 2021 update on the COVID-19 pandemic. My name is Don Walker. I am the Communications Director for Brevard County Government, and we have a panel of folks here today that are going to give you the latest updates on how Brevard County is faring through this pandemic. With us on the panel today, we have Helen Medlin, who is the Epidemiology Manager for Florida Department of Health Brevard. We have Maria Stahl, who is the Administrator for DOH Brevard. We have John Scott, our Emergency Management Director. Matt Wallace, our Public Safety Director. Mark Schomeyer, Chief of Brevard County Fire Rescue. Catherine Allen, who is here representing Brevard Public Schools. And we also have Jesse Ray, our Social Media Specialist, who will be monitoring comments on this Facebook Live event and will pose any questions that our audience asks to the panel once we've completed our updates. So with that, we will move on and start our update with Helen Medlin from FDOH Brevard.
Thanks, Don. I hope if I have glasses. I'm just going to start with our rates. The weekly report hasn't been published for today, so I don't have specific numbers, but I can speak to the trends that we're seeing. So Brevard County, we saw our peak in the week of August 13 to August 19 with 4,550 cases. Last week, we started to trend down in numbers of both cases and our positivity rate. We continue on a downward trend and saw a moderate decrease this week with those trends. With our hospitals, we are seeing some decrease in hospital occupancy. The majority of those hospitalized are those who are unvaccinated. And again, these trends are following our numbers. Our vaccination rates, we were at 64% of those 12 and over last week, and we have seen a slight increase this week, but there is actually a decrease in those receiving the first dose of vaccines. So, it's of note that the vaccine is effective, particularly in preventing severe illness, hospitalization, and death from COVID. So it's important that people continue to get vaccinated. Our death rates also mirror the increase and then the decrease in our case numbers. So Brevard County, we report our deaths to the state, and the state will report those to the CDC on the website. I believe we have the link for that.
Yeah, he's got it.
Okay. So these reports do lag in actual time because we receive the information from multiple sources, the most timely being the hospitals, but there are other sources for which the deaths are noted. We investigate each of those deaths to make sure that they are a COVID-related death as opposed to, for example, someone who died in a car accident but had a recent COVID test. So the numbers do lag on the reports, but we do try and get them out there in a timely manner. As soon as they come to us, we investigate them and we report them within 2 to 3 days of us getting them into our department. And that's all that I have. Thank you.
All right, thank you very much, Helen. Been a lot of activity this week in Brevard County as far as testing goes, and I'm going to turn it over now to our Emergency Management Director, John Scott, for an update. John?
Thank you, Don, and good morning, everyone. Again, my name is John Scott. I am the Emergency Management Director for Brevard County. Talk about a couple of things. I'll start with testing. We're very excited. Throughout this week, we've been able to open additional testing options for our residents. The Department of Health at their side has been doing testing for residents by appointment only. With a partnership between ourselves and Parks and Recreation, along with the Department of Health, we were able to open an additional testing site at Kiwanis Park. That site is open 7 days a week, 9 to 5. That is a drive-up. No appointments are required, but we do encourage pre-registration. You can find that link on our website and in a variety of places in which we announce that. We also this week partnered with the City of West Melbourne to open a testing site at the West Melbourne Community Park, which is right off of Minton. For those who know where the Field of Dreams is, it's right there. That site is also 9 to 5, 7 days a week. Again, no appointment required, but highly encouraged to pre-register. It makes the process go faster. Again, you can find that link on our website. And then today, Parish, partnering with several organizations, also entered the testing realm for us with them. They are 12 to 6 today, and then after that, they are 9 to 5, 7 days a week. Again, those are appointment only at Parish, and you can register on their website. And we'll also make sure that was in our press release yesterday, and it's on our website as well as far as all the updated information with testing. So very excited that we're able to get increased coverage about testing out there. Hope folks are taking advantage of those opportunities and looking forward to watching those sites as they grow. Talk briefly about our monoclonal antibody site, which is also located at Kiwanis Park. Again, as a reminder, that is a COVID treatment. You do not need a doctor's note, a referral of any kind. It is for those that are COVID positive, folks with symptoms of COVID, or folks who believe they've had a close contact. Again, that is a treatment. It is 4 shots, 1 in each arm and then 2 in the stomach. And then after you receive those, it's about an hour. So just a reminder, if you are going to go down there, again, that's appointments preferred, but walk-ups are accepted. If you are going to go down there, plan on being there for a while, at least probably 2 hours to get through the treatment, and then you're observed for an hour. That continues to go well. We continue to see a lot of our residents utilizing it, and I think we're all fairly optimistic that it is helping to make a difference when it comes to our overall hospitalizations. The last thing I want to hit on is what I've hit on every single week we've done these for the last month, is the importance that the important role we all play in ending the cycle of transmission and helping to get our numbers down. While we heard encouraging numbers from the Department of Health when it comes to numbers trending down, hospitalizations trending down, I want to highlight that those numbers are still well above any previous peak we've had before. So while good news, far from great news. And so we need to continue to end that cycle of transmission. That means wearing face coverings, washing our hands, practicing social distance where possible, and most importantly, if you are sick, stay home, isolate, don't go out and interact with people, in the cycle of transmission with yourself. So we can all do that as a community. That's something we should all be doing, and that is probably the single largest thing we can do outside of getting vaccinated to help control those numbers. So please, please, please help us in the cycle of transmission. Don?
All right. And John, just to clarify, and please correct me if I'm wrong, Parish Medical Center starts testing at noon today for COVID-19, but after today, it doesn't move to the 7-day a week until Monday, starting Monday through Sunday?
I believe you're correct, yes.
Okay, all right, thank you. All right, and now we have Catherine Allen to provide us an update from Brevard Public Schools. Catherine?
Thanks, Don. Again, my name is Catherine Allen, Senior Coordinator with Brevard Public Schools District of Communication Office. As Helen mentioned, the community is seeing a bit of a downward trend. We're pleased to report that our numbers are also starting to trend down in both cases and quarantines, though, to John's point, they're still much higher than we saw last year. So this is the time to just stay vigilant and keep practicing social distancing wherever possible, good hand hygiene. And obviously our schools are instituting a mask mandate. And we just want to make sure that we say a special thank you to the faculty and the students and the families that are making that possible. We know it wasn't a popular decision. We know that there's a lot of opinions, but we need to do whatever we can to slow the spread and keep our kids in school where they're learning. We want to encourage people that are looking for testing sites for either BPS staff members or students to check our website, brevardschools.org. And we have all of that information, both date-specific testing locations that are drive-through, but also regular testing sites for the county. And we'll continue to post when there are new testing sites that we're made aware of. So we're all working together as county, departments, working together to make sure that people have that information. And just as a last reminder, if your child is on day 5 or later of their quarantine and they have had no symptoms, they are able to go get tested, provide that negative test result to their school, and return to the classroom. That's all.
Okay, and I just wanted to say from a communications standpoint that about 18 months ago, and in fact on March 16th of 2020, I wrote a press release about the first confirmed case of COVID-19 in Brevard County. And as was spoken here today, we're at over 72,000 currently. And also on April 7th, I put out a press release that we had 2 confirmed deaths from COVID-19 that had occurred one after the other in a 2-day stretch. And now we're at over 1,300. So we cannot stress the importance enough to, not let your guard down, stay vigilant, and get the vaccine if you can. So we will turn it over now to Jesse Ray to pose some questions that we've received from our audience. Jesse?
Awesome. Thanks, Don. Okay, so this question is for all of the panelists, really, anyone who wants to take a stab at this. What is the reaction of the panelists to President Biden's plan to require businesses with 100 or more employees to either have their employees vaccinated or tested every week for COVID-19? The plan would affect county government and the school district, for example. Anybody?
I'll take it. And I think I speak for all the panelists when I say it's fairly simple for us. We follow the law, we follow the science, and we follow our board.
Yeah. Oh, awesome.
Our board being the Brevard County Board of County Commissioners.
Right.
And Jesse, I will just add to that, we cannot emphasize enough the importance of vaccinations. Vaccinations, as we've heard over and over and over, is going to get us out of this. If we don't increase the vaccinations in our country, in our state, and in our county, the Delta variant and other variants are going to start. This is not going to go away till we have enough of people vaccinated. It's unfortunate that we have to have rulings come out on this or that, because it really is as simple as people need to get vaccinated. And that is the #1 way of breaking this transmission, is getting vaccinated.
Thank you, Maria. Go ahead, Jesse.
Okay. Are the hospitals counting vaccinated and unvaccinated deaths? Like people who are vaccinated and unvaccinated, are they counting both in our death count?
So, yes, they will report to us any death that is COVID-related, whether the person is vaccinated or unvaccinated. So we do see the rates between the differences between the death rates of those vaccinated and unvaccinated, yes.
Okay, and so a follow-up to that. So how are we sure that that the death has occurred because of the illness from COVID-19 and not from getting the vaccine?
Typically, the deaths that we see, these people are symptomatic for COVID. And some of them have quite significant illnesses to be hospitalized. They also have a period of time where they're ill. So these are things that we investigate. And if there was any time that we felt that it was related to a vaccine, that would also be reported as a vaccine-related illness or death.
Okay, thank you. Okay, the CDC's latest report shows that there have been a total of 1,322 COVID-19 related deaths in Brevard County as of September 4th. That is up 83 from the week earlier. How would you describe this level of deaths in 1 week, and is it a record for the county?
The case numbers and the death rates do increase. They have, obviously, with the number of cases. I can't speak to whether it's a record. I do not look at daily or weekly numbers per se, but I can tell you that it certainly has increased over this period of time. There is, as I've said, a lag in the reporting of deaths because we do investigate each and every one of them. So I think that you will see, probably in a month's time, that you will see more significantly how this virus has affected the community.
Okay, Thank you.
I'll add to that, Jesse, and say, and I mentioned this on a previous Facebook Live event, and what everyone needs to realize is when the cases are up, the hospitalizations are going to be up, and the deaths are going to be up. And it's going to be about a 2-week lag. So the peak of cases, about 2 weeks later, you're going to see the peak in hospital admissions, and about 2 weeks later, you're going to see the peak in deaths. And as we know, as we reported several weeks ago, was really our high point, right? So 2 weeks later is the hospitalizations, 2 weeks later is going to be the deaths. So overall, our deaths are up, as is our cases, as is our hospitalizations.
Yeah, and I just want to say, too, in comparison, when we're talking about hospitalizations, as I mentioned, the press releases I wrote 18 months ago, at that time when we had 2 deaths, there were only 28 people hospitalized in Brevard County with COVID-19 versus, as of Monday, 357 that were not fully vaccinated and 15 that are fully vaccinated. And by not fully vaccinated, because I get a lot of questions about that, they've received at least one, or they may have received at least 1 dose, but they haven't received 2 doses, or no doses at all, so.
Okay, thank you.
Jesse.
What are the vaccination rates for children under 18 in Brevard County?
The vaccination rates for 12 to 19, because that's how it's reported out, not 18 but 19, but 12 to 19 is 45%, which we really do have a long way to go there.
Yeah, that seems a little low.
Yes.
What are the vaccination rates for teachers in Brevard Public Schools? I don't feel like that's something.
I was going to say, that's not anything that we would have data on, because we report by ages.
Right.
It's
Not
not
by-
reported by where they work or occupation.
Right.
How about Catherine, any input on that from you, from BPS?
I agree that I can't provide a specific number, but what I can say is that our district worked very hard to provide vaccination opportunities early and often, and many, many, many members of our staff, bus drivers, teachers, custodians, cafeteria workers across the board took advantage of those opportunities.
All right, thank you.
Excellent, thank you. So for our DOH representatives, we've heard through the news and things that hospitals and others are running low on liquid oxygen. Is this something that we're seeing in Brevard County?
What I can say is that we do have twice-a-week hospital conversations, us in emergency management, that has not been reported that has been a shortage at all in Brevard County.
Okay, good to know. Guess the launches are on then. So while we're on talking about vaccines, have we found that there is one that's most effective or more effective than the others?
With the vaccines, it basically, they're all good vaccines. The data coming out is showing, it depends which report that you look at as to the efficacy of each of them, and also their efficacy against the different variants as well. So there are many reports and there are many different opinions of that. That's not really the important thing, though. The important thing is that you get vaccinated, and what you want to do is don't give up the chance to be vaccinated because you don't think that's the right vaccine for you. Mm-hmm. Missed opportunities often lead to people getting the illness and being very sick. So whatever is available is the one that's right for you.
Okay. And you mentioned variants. Some of us have heard of the mu variant that's coming out. Did you want to speak on that, or John at all? Speak on? Okay.
I can speak a little bit to it, and probably only as much as everyone else has read. There's not a lot of information out there about the mu. The one thing to know is there was some discussion that it may not be, the vaccines may not be as effective against this variant. But it's important to note that the variants themselves can often kind of compete against each other in a population. So just for example, the dominant variant right now is Delta, and prior to that it was the UK variant. So we saw that the Delta variant basically took over and was more virulent and forced the other variant out. We don't know yet at this point in time, and I've not seen the data to see how virulent the Mu variant is, and whether we would see that come into our society and kind of push the Delta variant out.
Okay,
And
excellent.
there's one thing I just want to add to that, just to build on what Maria and Helen said earlier, which is the more time we spend with lower vaccination rates, the more variants that are going to be a thing. So it's Mu now, it can be another thing after that. What we can control in this conversation and what we can control from a community perspective is we increase our vaccination rates. The higher those get, the lower our risk is to whatever the next variant is. So we cannot, underscore enough the importance of getting vaccinated.
Gotcha. Thank you, John. So, John, I've got a couple for you. So the new drive-up testing that you mentioned and that we've put a press release out on, is it rapid tests or is it PCR? Is it both?
Both options are available.
Excellent. And also on the topic of testing, we have a couple of people that are concerned that cruise ship passengers are kind of utilizing all of the beachside testing appointments. Is there any plans or discussion happening about possibly opening up more testing at the port to help with that volume?
We continue to work with our port partners on those things. One of the reasons we chose the Kiwanis site as a testing location was specifically to reach our Barrier Island residents, both those in Cape Canaveral, Cocoa Beach, Satellite, Indian Harbor, Indian Atlantic, and Melbourne Beach, but also those on Merritt Island as an effort to sort of continue to make more tests available regardless of where folks are coming from.
Awesome. The monoclonal site, I know that we've talked about it before, but when is the right time to say I need to go there and get the treatment?
The short answer to that is when you're symptomatic. That's the best time. That's when it's going to be its most effective, and the earlier in that process you can. If you're concerned about this, and I think this is a part of this conversation that folks aren't always considering, and they should be, which is when in doubt, talk to your primary care physician. Ask them. They know you. They know your medical history. Ask them what's best for them. But in general, the treatment is most effective the earlier you get it.
Okay. And I think I've only got time for one more here. Helen, we've talked about variants and we've talked about the vaccinations. Can we kind of talk a little bit about how variants come about? Like why are we seeing variants? What happens? How can we help stop variants?
Sure. So we see variants occur when we have large amounts of people infected. And the reason being is every time someone is infected with the virus, it can change. Mm-hmm. And so as that happens, the more often that one virus starts infecting whole groups and it changes and changes and changes, then you find that there's that one variant that will win out against the others. And so what we see is the variants occur in populations that are under-vaccinated, because that's where this virus has the opportunity to multiply at such a high rate and such a high level.
Okay. Dawn, I think that's all I have for today.
All right, thank you, Jesse. And we talked a lot about vaccinations and the importance of being vaccinated. And I thought I should take just a minute to tell you where you can get vaccinated if you haven't been vaccinated as of yet. Today, there's a vaccination outreach clinic at Greater Allen Chapel AME Church at 2416 Lipscomb Street in Melbourne, and that runs from 3 to 7 p.m. There's one on Saturday at Brevard Nursing Academy at 1581 Robert J. Conlon Boulevard Northeast, Suite 106 in Palm Bay, and that goes from 10 a.m. to 6 p.m. And then I want to mention that CVS, Walgreens, Walmart, Winn-Dixie, urgent care centers all throughout the county are offering the vaccine with evening and weekend hours and are located, like I said, throughout the county. So, there are ample opportunities and ample supplies of the vaccine in Brevard County to get vaccinated. All right, so that ends our conversation about COVID-19, but I do want to turn it over to Emergency Director John Scott again, just for a quick update on hurricane season. John?
Thank you, Don. And again, thank you for listing the sites folks can get vaccinated. Also, the Department of Health has them available as well for folks who need it. So yeah, Don, thank you. Let's talk a little about hurricane season, as today is the statistical and climatological peak of hurricane season. So a lot of people think, oh, that's great news. That means, we're on the downside. We can begin to relax. Like, again, bearer of bad news today, that is not what that means. Just because we're at the peak statistically, that is not the peak for Brevard County or Florida. So statistically and climatologically, September and October are our busiest months when it comes to hurricane season and when our threat is the highest. So we're going right into the teeth of that. So it's important that everyone continues, as we're dealing with COVID, as we're dealing with our general lives and all of the different things we have to juggle, that we keep an eye on the tropics. Just because there's nothing out there right now coming our way doesn't mean something won't come up tomorrow. It's really, really important that we all have a plan, that we've all built a disaster supply kit, that we know what we're going to do in the event a storm does threaten our area and there is a need to take protective actions. We know where to get good information, and that we're communicating with our family members and our neighbors to make sure we're all doing everything we can to be as ready and then resilient as possible. So again, height of hurricane season, statistical, climatological peak, September and October are big months for us. So let's not let our guard down.
All right, thank you, John. This weekend is an anniversary of an event in our nation's history that we don't want to let go by without acknowledging. And to wrap up our program today, I'm going to turn it over to Public Safety Director Matt Wallace. Matt?
Thank you, Don. And we would be remiss if we did not talk about the importance, like Don said, of what tomorrow's date is in our nation's history. If you're my age or a little bit older, you'll know exactly where you were 20 years ago tomorrow about what happened and what went down. For me, as many of y'all know, I'm a retired military person that before I took this job, 20 years ago, I was Captain Wallace sitting at MacDill Air Force Base in a CENTCOM commander's staff briefing with General Bubba Frank sitting at the head of the table when the first plane hit, and then the second plane hit, and then the Pentagon got hit. And that day fundamentally changed the lives of the entire nation. We saw the nation come together, communities come together, the state came together, the country came together as we found one issue that we all were very laser focused about. And it was a very sad time in our nation's history, but it was also a fantastic time of our nation's history as we came together as one people to fight one common enemy. As my career continued, that gave me multiple opportunities to see the world from Asia to Europe to the Middle East multiple times. And as I got to see what this country was about and the things that we did, please make no doubt that this country is the greatest country this world has ever seen. And we are privileged and honored to be here and very lucky to be citizens of the United States of America because of the things that we've done and the things that we're going to do as this country as a whole. So as the events of 9/11 happened and as tomorrow plays out in our nation's history, I just ask that just take a moment to think back and reflect about where we've been, where you are in your life, the things that are important, those that you love, tell them you love them every chance you get, because this life is short and we're not guaranteed a future. And if, again, my Air Force's career has taught me anything about that, it's taught me that. And as we go through COVID and we go through hurricane season and all the things that we're going through, be sure to squeeze the ones you love, tell your family members you love them, and again, just tomorrow, take a moment of time and think about the things that have happened in your lives. I appreciate y'all always tuning into these. These are great information sessions as we as a county government are here to serve you and get the correct information out and put policies and procedures in place to make sure that we protect you. My job as the public safety director is just that, public safety. So please be safe. Please be safe this weekend. Please be safe in everything you do. Make great informed decisions for you and your family. And we look forward to seeing you again next week. So thank you, Don.
Thanks, Matt. That concludes our program.